to our network meeting. Yeah, my bad. To our network meeting. I'm all talking. I had a whole sermon. Like y'all missed all kind of stuff I was saying. But we had quite a few people who were not available today. But appreciate folks who were able to come. Some of our managed care plan partners weren't available. And then I do still see Jill here. But I want to first start just for this being our first meeting of the year. Just everyone get an opportunity just to introduce themselves. We have some new folks in the room. So I'll first introduce myself, James Sauer, Program Manager with Healthy SBCSS, and then I will pass it over to my director, Farah, to introduce herself.
Hi, everybody. Farah Northcott, Director of Healthy SBCSS, and I'll pass it over to Karen.
Hi, everybody. I'm Karen Delatorre, Community Health Systems Specialist with Healthy SBCSS. I'll pass it to Alex.
Good afternoon, everybody. My name is Alexandra Gonzalez, and I'm also with Healthy SBCSS. I'm a Community Health System Specialist, and I will pass it over to Marissa.
Hello, good afternoon, everyone. My name is Marissa Smith. I'm a Program Coordinator here with Healthy SBCSS, and I'll pass it over to Marwa.
Good afternoon, everyone. My name is Marwa Ahmad, and I'm a Community Health System Specialist with Healthy SBCSS. I'll go ahead and pass it over to Cecilia.
Good afternoon. I'm Cecilia Gutierrez, Coordinator for Health Services at Rialto Unified School District. I don't see everybody else on the screen, so I guess Liz, I'll pass it over to you.
Good afternoon, everyone. Liz Romanio from Fontana Unified School District Social Emotional Support Specialist. And I will pass it to, to Marissa.
Everyone already, but we can pass it to Gabriella.
Good afternoon, Gabriela Isaac. I'm Program Manager with the Ontario Montclair School District, and I'll pass it to Jill.
Hi, everybody. My name is Jill Smith. I'm a Program Manager here for the Department of Behavioral Health for San Bernardino County, and I will pass it to Gia.
Good afternoon, everybody. My name is Gia Robles, and I'm one of the Program Managers for Desert Mountain Children's Center.
And I think I seen Jillian come in from Kaiser. You want to introduce yourself, Jillian?
Hi, James. Yeah, sorry for joining late, everyone. My name is Jillian Stuckey, and I'm from Kaiser Permanente.
And I think somebody else had just came in. Gretchen, you want to introduce yourself?
Hi, my name is Gretchen Shanofsky. I'm with Kaiser Permanente.
Thank you for coming, Gretchen.
Delighted to be here.
Yes. So again, this is a network of partners really championing the behavioral health services in San Bernardino County. So again, we have some school sites. We have our San Bernardino Department of Behavioral Health, and then some of our managed care plans. Just a space for us to begin to start aligning and working towards the system of care that we want to build in our county. And so this is our first one. We had 3 meetings last year, right, team? We had 3 meetings last year. So this is our 4th meeting, and our intention is to really develop a toolkit that we can build and deploy across our county for school districts to really build infrastructure to really support students around behavioral and mental health services. Okay, so today really want folks to speak. I need y'all to be talking as we're going through, because I really want to get some feedback on just some of the things that's going on with the capacity grant, how it's being implemented in your school sites, what you're seeing, what do you feel districts may need. So as we're going through some of the slides, certainly want you to raise your hand, give feedback into some of the data that we're seeing, as well as put your caps on just around the school-based health center and wellness center conversation. So we're going to have a conversation around school-based health centers and wellness centers, and really how we can leverage those 2 strategies to really support the infrastructure, right? So we had an opportunity Farah and I had an opportunity to speak and present to our behavioral health commission around these two strategies, and really see these two strategies as the opportunity to lift up the work happening with behavioral health, mental health, physical health, as well as community school work, right? And so really want to get everyone to lean into us as we have a lot of districts and LEAs who are really putting a lot of time, energy, and resource into school-based health centers. So us really leveraging that work that's happening in our LEAs to really lift it up and align much of our services, which go really well with the managed care plans and the prevention work that Kaiser wants to do, and IHP and all these different managed care plans want to do, as well as services being brought to our schools. Okay. And so we want to have that conversation. So please make sure y'all don't just let me do all the talking and you guys are actually engaging, or at least asking questions, right? And Marissa and team, please don't hesitate to jump in. So we'll go to the next slide. I think the next two slides, right? So we want to make sure we update everyone on this. And some of the folks who are always in our community of practice meetings, our LEAs, we have meetings every other Thursday to meet with folks who are in the capacity grant, the LEAs who are in the capacity grant. So some of this might be redundant for some of our school sites, but certainly want to make sure all the partners are understanding where we are. For folks who may not understand the capacity grant, just a quick opportunity to kind of look at what it is. One-time funds that the state provided to all 58 counties. And in San Bernardino County, we have 56 LEAs who are participating in this. So I know, Jill, you heard some of this last year. Gretchen, is this old news for you as I'm going through this, or is this new for you?
New.
Okay, good. Thank you, Gretchen. I needed that. Thank you. No, so this is the state has invested money in all 58 counties to build infrastructure for the multi-payer fee schedule. And we'll talk more about that, Gretchen, but the multi-payer fee schedule is another mechanism that we are utilizing to fund and sustain some of the services that are happening in our LEAs and across our state, right? And so in San Bernardino County, we have 56 LEAs who are participating. And when we say LEAs, we're talking districts and charters, right, who are participating in the capacity grant. And then the LEAs established the implementation plan that is based on the priorities that you kind of see here, right? And so Medi-Cal enrollment, and in our next slides, is kind of show you what these kind of mean, right? But again, the intention is that our districts were dispersed, money was dispersed to our district to really help them build infrastructure wherever they are in their context, okay? And so this is to support their ability to reimburse for services that they are providing to their students, and reimburse and send claims to managed care plans and to private insurers. Okay, so really all of our schools really becoming, our districts really becoming a network, a mental health network, and provider network. Okay. So we go, and if you got any questions come up, y'all, please raise your hands. But as I was saying, the definitions of some of those things, Gretchen, those areas and those buckets of work, you can kind of see them here, and we'll make sure the slide deck is available to you as well. But this is the number of districts from the implementation plans of this is what our districts are engaging in. So we have 12 districts who are working towards Medi-Cal enrollment. So those numbers are what districts have, or LEAs have said that they want to work towards, right? And so we have 56, but you can have multiple priority areas, right? So I just want you guys to see the snapshot of what our LEAs are trying to accomplish, right? And so as you can see, many of them are putting their buckets, putting a lot of priority inside around the service delivery infrastructure, right? So where activities directly related to LEA's effort to deliver needed behavioral health services. So of the 56, 53 districts have some kind of work happening around that service delivery infrastructure. When we're thinking about the service delivery infrastructure, that's one aspect of the toolkit that we want to stand up. But again, without the billing infrastructure, without Medi-Cal enrollment, without collection of data, you can't really do the services and reimburse. So many of us in schools have been providing services, but we have not been doing it through a whole systems approach and in a way that we can reclaim some of the funding back for those services. And so when we're thinking about sending claims to insurance, there's much more that we have to do than just provide student services, right? Any thoughts, any surprises of this data that you're kind of seeing and where you see where our LEAs are prioritizing? Anyone? No, Gretchen, anyone? Especially when we think our school site folks, right? Where our does this surprise you where our schools and our districts are, where they want to prioritize their information, or this seems like this is about what we want to do too? School districts, LEAs. Y'all want to say nothing, huh? Jill, what about you from the DBA side? Does this seem like any surprising, anything stand out? Anything, Jill?
No, actually, I'm not surprised actually by looking at this. I do think the medical enrollment and the LEA admin and maybe the data collection, it was maybe a little more not shocked. I just don't know where everybody is in their process, but that those numbers maybe weren't a tinge higher. But
Yeah.
again, they have multiple resources with management sometimes in those areas, so it could be coming in somewhere else. So, but other than that, no, it's pretty where I thought it would be.
Yeah. And for context for folks in the room, when we're thinking about DBH and the work that Jill and Dr. Haugen and their team leads, they really are that third level of the support for what we are really championing and really pushing our districts to really develop this multi-tier system of support, where they being the LEAs, are really lifting up the work around prevention and early intervention. And then our DBH contracts, DMCC, who also has one with our county, would provide that higher need support. And when we think about how some of our districts and LEAs have participated or tried to utilize our DBH contracts, they have tried to put them in all three tiers. And so some of the work that we've been doing from the county office is really helping our districts understand where they start and where our DBH contract should take on, right? And so as we're looking about Medi-Cal enrollment, we're looking at all these different infrastructure, these pieces. We're not asking our districts to do everything, but we do want our districts to really strengthen their ability to provide the preventative and the early intervention supports for their students, and then utilize those Medi-Cal or the DBH contracts in a way that supersedes the supports that we're able to give at our school sites. Does it make sense to everyone? You can nod heads or thumbs up or something, right? So that's a major part of the work that we want to be doing in this room as well. As we build a toolkit that we're helping our schools really implement a multi-tier system of support that doesn't take a lot of thinking, because they don't have a lot of work. A lot of people don't do, school people have not been doing this kind of work, right? So this is really not principals, superintendents kind of jam, right? So we got to really create something that our school leaders can really dissect and really bring forth. Okay. And then, so like Liz, when you think about Fontana and the work that you do, right? When you think of how our DBH contracts and the multi-tier system support, is this aligned to what you see and what you hear from some of your therapists and not just your therapists, but you also lead the network of therapists in the county. So does this align well to that, Liz?
Yes, it makes sense. It all flows together. Yeah.
Okay. Okay. So again, really need you guys to be that kind of watching for us, right? Like we don't want to be making things in a vacuum, right? So just really want to be gauging it. Let's go to the next slide. And so what the LEAs are doing, again, just another picture of what we're seeing and what we're getting in the implementation plans, right? So training staff, a lot of folks are really training staff to become certified wellness coaches. So these certified wellness coaches, new position in the state, identified role in the state that can bill. And so what we're finding, okay, Jillian, what we're finding is that many of our LEAs are seeing this as an opportunity to get their interns certified. And as they get their interns certified, their interns now are able to uh, generate claims, right? So again, on the fee schedule, the interns are not on the fee schedule. Associates are, but many times, many of our districts' systems are built around interns, and so you get those interns certified as wellness coaches. They then are able to bill for the services that they're providing. So districts are beginning to understand how to I keep saying leverage, but how to utilize the fee schedule in a way that can bring in services, right? As well as LEAs are looking to purchase spaces, and that's one of the things that the money could be utilized for. And when we're looking at that service delivery bucket of work, it isn't just the provision of services, but also spacing for space for services. So we're seeing a lot of districts who are looking to create wellness spaces, utilizing buying Zen pods and dedicated quiet rooms, right? So they're utilizing their funds in that way as well. As we're looking and we consider the toolkit, really looking at us identifying those resources, helping districts to understand it. So again, a lot of information. I want you guys to just be thinking about that end goal of providing districts with a toolkit that they can utilize to meet their needs without too much trying to go research these things, right? So we're utilizing the capacity grant as an opportunity to really learn the field and learn what folks need and how they did that. So we're taking all that stuff in, then we would bring that information to you all. And then lastly, just LEAs are in the implementation phase of utilizing an EHR, right? So many folks didn't even know what an EHR was. I think 2 or 3 years ago, I wouldn't necessarily know what an EHR was, right? But now our districts are really utilizing that language, utilizing language, and now stepping to the point of actually implementing. And we have some data around that too. So we go to the next slide as well. And so I kind of talked about the fee schedule. And again, Gretchen, here you go. And like I said, these slides will be available. But again, just a foundational infrastructure and sustainability, right? So as funds have depleted in the state, ESSER funds, COVID funds, and districts were able to build a lot of systems or services with those funds, and those funds are no longer available. The fee schedule is one mechanism that can be utilized to actually sustain those services that have been built thus far, right? And so as a county, we are really utilizing this fee schedule and this capacity grant as a means to really congregate our LEAs around this strategy and this structure. So we're really looking at it as a backbone to support our countywide wellness system. And we'll talk more about that with the wellness centers as well. And then the fee schedule also, right now we're in the 5th cohort. So in the 5th cohort, 5 cohorts, these cohorts are early adopters of this fee schedule. So the state DHCS is utilizing these cohorts as guinea pigs or as early adopters to the work to really identify what works and what's not working. And we'll show you some data of who's in those cohorts. Let's go to the next slide. I guess that's the slide, right? So you can see in San Bernardino County the number of LEAs who are actually participating in the 5 cohorts, right? So as you see, this is something in our county that has really become has caught fire. and many of our LEAs are looking to participate and utilize the fee schedule, right? So even though they signed up to be a part or are a part of the capacity grant, they did not have to be a part of a cohort. So our districts, our LEAs who are participating in cohorts certainly have done this on their own will. It was not an expectation for their participation in the capacity grant, right? So this is I want to give a shout out to the team who's supporting our districts, because they're helping our districts get ready. So I want to give a shout out to my team and Healthy SBCSS, who's helping to consult and coach this. But really, our districts are really adopting this idea as an opportunity to really support our students, right? So again, thoughts around just the number of districts. Surprised, not surprised, excited, not excited, want to see more? What?
James, I have a question.
Yeah, huh?
How many districts do we have? How many LEAs do we have in San Bernardino County?
In San Bernardino County, we have I think we had 91, and two district or two charters closed down. So I think we probably like at 89, I think.
So more than
team,
half are
right? 89?
participating. So more than half participate in this then?
Yes. 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 And like I said, I think those two districts, we knew that those two LEAs, those charters closed because they too were participating. So we had 50, so it was actually 3, because we had 59 districts who were participating in the capacity grant. Now we have 56. So certainly a lot of engagement and participation in our county, which is rare, because many of the other counties are not doing it at this level. And so we've got a lot of feedback from the state, just asking questions about how we're doing, what we're doing in our capacity grant, right? And so again, just a testament of the team's work, but also a testament of the prioritizing of our districts around this work, right? Right. And then Liz does the network of therapists in our county. She leads the therapy, the physicians network in our clinician network in our county. Are you seeing many of your folks, the network people's districts on here? Because I know there's a disconnect from our clinicians and our school leaders around this work. So I want to make sure that we.
Yeah, we've had our first meeting this year of the school-based mental health collaborative. And I know that we have Redlands that comes. I don't know if we have anyone from Rialto that has joined us, but we have Ontario Montclair, San Bernardino City, Upland, of course, Fontana, and Colton joined. Ukaipa joins us. Looking at this list here, I think Apple Valley has come on board with us. Victor Valley was with us the last time. And then, of course, we have a few outliers that go LA County and Riverside County that come on board and join us as well. But yeah, and Silver Valley was with us this last time. Yeah. And we do have a presentation up the hill with Victor Valley and Apple. So yeah.
Okay. Yeah, certainly. Again, we have to, in our assistant soup here always talks about the work transferring to the classroom, right? And so getting to the classroom or getting to the students is first getting to the staff. And so as we are implementing this work, the fee schedule, capacity grant work, that we are getting it to the clinicians, and clinicians are actually having a voice in the way that this is being implemented in their districts. Right, so that is a focus, and that's why I'm happy Liz is in the room with us, because she can provide some of that feedback for us of how we can make sure to support districts in involving the clinicians in their districts, right? Because that's going to be key to the success of this, especially when the clinicians know the work, they know the direct service aspect, they know the billing, they know all those, and our some of our school leaders, again, none the wiser to none of that stuff, right? So we want to make sure we marry those two things, right? So thank you for that, Liz. So we go to the next slide. So certainly want to lift up, and we have Gabrielle in the room from Ontario Montclair, but just want to lift up just the fact that our districts are beginning to bill, right? Actually getting reimbursements, right? I just got a information from Healthy Campus on just where Colton and Upland are already doing a great job of reimbursing. Ontario Montclair was our first district in our county to actually receive a reimbursement. So certainly want to give a hand clap to them and just highlight the work that they're doing at Gabriella and Cara and all of them are the work they're leading there. Gabrielle, any conversation or anything you want to lift up just around just the process that you guys have gone through to get where you guys are, you know, around the fee schedule and um, things like anything, Gabriella?
We're just learning a lot as we go.
Hmm.
Those office hours with DHCS are helpful sometimes.
Yeah.
I know that they're building the program as we go, so there's always something to learn. You know, they add new activities that we're able to build, or they add new providers, and then some of the things are taken away. So we're just trying to maximize and make sure that we're not creating more work for the staff, but
Hmm.
that we're actually capturing the work that they're doing
Right.
and
Yeah.
what in their role, and then billing for that.
Yeah.
So it's been, you know, most of the staff that are billing in our district have never billed before in their life.
Hmm.
So it's a lot of PD, you know, a lot of support, a lot of, you know, we have like I don't know if to call it like a leadership team that deals with fee schedule. And that team is the one creating, you know, the systems
Yeah.
that we're implementing. And we keep, you know, I think flexibility is key.
Hmm.
As we keep learning new things, we keep just modifying things. So
Well, that's
we're
good.
excited, yeah.
Yeah. And so, Gabrielle, you guys have almost like a steering committee or a leadership team that's actually helping to build the system. So that's something that we want to take note of probably a best practice, right? Because this is so new. So that's something that, again, I'm just kind of talking out loud to the team of us just making sure we capture that as as a opportunity for districts to really engage in developing that team, right?
Yeah,
Developing.
so in the steering committee, we have people that represent all the sectors that are billing.
Hmm.
So we have a PPS rep, we have our billers, of course, we have our director, we have somebody from the clinical team. Who else? Somebody that represents the CWCs.
Hmm.
So all that there's a rep for each group of people that are billing
Right.
that kind of bring the feedback to the group.
That's good. Mercy, you gonna say something?
I was just going to say shameless plug for our community of practice this Thursday. We have two of our LEAs that are already part of the fee schedule and billing. They'll be presenting this Thursday just in some of their best practices around being able to leverage the fee schedule and individuals that are part of their practices and their steering committees. And so if that's something that you're interested in seeing and being a part of, that'll be this Thursday, I feel like at 2 p.m. My time is wrong, the girls will correct me, but this Thursday. So we're really using our office hours and our community of practice hours as really an ability for our districts to be able to network and to really learn best practices from each other as we continue to kind of get into this work. I think James said it best. This is not an educator's field at all. And I think that the educators are doing the best they can to learn as they go. So really creating a sustainable network where we can learn from each other as we have successes has been an integral part of the work we're doing here at San Bernardino County. So I just wanted to make sure I said that.
Yeah, no, thank you for that. And that's really key to all of it, right? All of us aligning ourselves and helping each other do this, right? Um, so Gretchen, what was that? Is there anything you're looking for health plans to support in this work? So of course, so Gretchen, a major aspect of the support we're going to need from our health plans is really just the true understanding of even how we engage with our insurers, right? Really the best practices around that. So that I think that's what we want to bring in our managed care plans in, or our managed care plans, or our insurers, private insurers, whoever is in the room, to really help us support or assist our school districts in this venture of really how do I actually become a network, a provider, right? And speak the language, make sure I'm putting in the right information and all the things that are going to go into actually getting those reimbursements back. So certainly just tapping in with Kaiser, with IHP, with Molina is going to help us really take that aspect around the reimbursement side, the sustainability, those things that we should be looking for as we are billing. And if we're not doing something right, really tapping in with you guys to really help us shift that. If that makes sense, Gretchen.
Yeah, what I'm just curious kind of a little bit about the timeline and like, are you looking for technical advisory sessions? Like what's would you like me to invite someone to come and speak to this group? Like what would be most helpful and what's the timing on that?
So I think kind of what Marissa was just talking about around our community of practice. So this year, our community of practice, we are making it much more practical. Last year was a lot of updating around the grant, right? The capacity grant. This year, we're doing a lot more practical implementation conversation. So it would be great to have connect with like with you, Gretchen, to get someone who can talk to our school partners around best practices in reimbursement and things like that. Some of the technical aspect of the work that you guys do. Now I know Kaiser does work across community work, school work. You guys do all kinds of stuff, but this space would really be great for our community practice, for our educators to really understand the technical aspect of what that insurance provider, all that kind of conversation goes. So if you're able to bring that kind of technical support to our community of practice, not necessarily this space. Now, what this space would do, we would be utilizing Kaiser managed care, our managed care plans, and our insurers to really help us build that toolkit that we would be able to provide to our districts when we're not able to talk to them, but we're able to give them something that they can actually utilize. If that makes sense, Gretchen.
Absolutely. And I think actually Jillian, my colleague here, would probably be the best person to be on point to help bring that in. Jillian, don't let me speak for you. But before we get there, I would love to ask just about, because I'm here for more of the population health work, Samarine, my counterpart. So we are looking to just sort of understand how this work ties into like the larger behavioral health program, goals, measurements for success. Also curious about like the Behavioral Services Act, Behavioral Health Services Act integration planning process and how this might be a piece of that. I apologize for showing up and not knowing the big picture, but I do have some big picture questions.
Oh, absolutely. No, that's all good. And part of that, that's why we also have DBH in the conversation, right? So when you're thinking about that BHSA really going through our Department of Behavioral Health, who is going to be leading that piece, and then as they build that out or they make that happen, then that us as educators really aligning our supports or our work to that. So this conversation, Gretchen, the big picture is really first and foremost really about alignment and collaboration, right? Where we actually find where everyone's lane is. Right? And as we find everyone's lane, then we too become able to generate something or create something that our districts don't have to learn the alignment themselves. That we do this alignment for them. So Jillian, Ms. Samarin, being in the space, really bringing in to help build the big picture, right? Helping to do that because that big picture in our county has not been. We have ideas of where we should be going, but we have not really practically made that happen yet.
Fantastic. So thank you so much for that. Like we have a lot of people that work for Kaiser Permanente. We all have different roles. It's, each of us in our own swim lane. And like I say, Jillian is more that local engagement representative who can help Kaiser show up at the table for implementation types of activities, technical activities, engagement related activities. I'm more in the population health management team. So looking to help Kaiser meaningfully participate in population health efforts. That would be around community health assessment, community health improvement planning, especially with regard to the Behavioral Health Services Act engagement. And of course, I imagine the work with the LEAs is a very important component of that. So like I say, just kind of curious how that implementation plan includes this work and how this all comes together to feed that conship process.
Yeah, and no, that's good context, Gretchen, and I think part of our I think maybe the next two slides would kind of talk about that. But before we move there, just for my own knowledge, when you say population health, what does that mean for us novice folks?
Yeah, so the state is establishing statewide population health goals for behavioral health, and they're mandating that the plans support those goals. One of them is on education, actually. So there is a population health goal to improve engagement in education as measured by graduation rates from high school, and there's a few different measures that they have. So basically just looking at all of the ways that the health plans can work with public health. We each have our own lane. The health plans in general are providing non-specialty mental health services. The behavioral health agencies provide specialty mental health services, but now there's a lot of new ways that we're working together. And then, like I say, DHCS has come out with these statewide goals for behavioral health, suicide reduction. I mean, there's a whole bunch of them. So I think there's 12 or 14 different goals. So just trying to connect the dots in terms of how this work feeds into the assessment planning processes. And Samarine, I see your hand is up, so help me out.
Yeah.
Yeah. I mean, so hi, I'm Samarine Shami. I was in the car with my teenager driving. That was absolute hell. So I was not able to. I am so sorry. I was basically terrorized, but she's just learning. So I couldn't come off mute because I was trying to do two things at once, but absolutely agree with what Gretchen said. And, each of the health plans, I think, we're all in collaboration in various counties, especially with Kaiser because it's in multiple counties. And we are working very closely on those PHM goals. Those PHM goals have been largely in the past a little bit more related to well-child visits and things like that. Mm-hmm. And now that this behavioral health component has been added, it's something that each of the health plans have been working on, but it's a way to bring it all together under the same umbrella of population health. And so this is really what Gretchen is talking about. And I wanted to actually introduce myself. I believe that many of you, or perhaps in the past, were dealing with Lisa Potter, who is part of Molina. And so since my team is taking over a lot of the school-based work, I know that she's, really helped and supported that work. So I did want to say myself, and some of you know Jasmine, we're in conversations with some of the schools as well, trying to really work on that really initial part of it. We are, in initial stages of sharing data and things like that. But yes, that's why I was so excited to join this, because I think what's happening right now, to Gretchen's point, is, all that behavioral health stuff has been happening, but there hasn't been that vision and that big picture, James, that you were talking about as well. So I think this new PHM work that we're supposed to all work on together and incorporating those behavioral health measures from DHCS is really trying to build that picture, James, that you're talking about. So just wanted to say hello.
No, thank you both, and I think it's very important. I think what we would need is really some a crash course around around those 15 or 12 things that you're talking about, that population health measure, right? Because that is one, of course, if you're engaging with schools, we want to make sure that we help be that bridge between our managed care plans or whatever partner and our educators, right? And our education, our LEAs. And so if we can understand it, then we can help put it into school terms and get the information and build the system that we're talking about we want to build, right? So we certainly don't want to be doing this work around the capacity grant, behavioral health work, and doing it in isolation of our managed care plans and the work that you guys have to do, right? The trueness around the alignment is really that your outcomes are covered and our outcomes are covered. And you talked about, I think Gretchen, you talked about something. One of the measures was around career or college and career or something. I think you said, right? And that's
Uh,
go ahead, Gretchen.
Yeah, there's one on schools, basically. There's a goal around engagement in school, and that is measured by a few things. One is 12th graders who graduated from high school on time. One is the student chronic absenteeism rate. One is meaningful participation at school. I'm not exactly sure how that's collected, but you probably do. And those are the three measures that relate to school. There's also others. There are, like I say, kind of a few. There's access to care, which would include access to specialty mental health, access to non-specialty mental health services. So basically the number of people who should be receiving services that are. There's homelessness goals, institutionalization. There's justice involved goals, removal of children from the home, untreated behavioral health, the care experience, overdoses, prevention, suicides. So there's quite a few.
Yeah, and just off the bat, just those first three that you talked about when you talked about chronic absenteeism, talked about graduation rates, and you said one more, but we were just in our differentiated assistance training this morning, right? So when we're thinking about California's dashboard of the schools districts, basically their report card, uh, three of those that you talked about are on those dashboards, right? And so
I'm looking at the dashboard right now.
yeah. So if when our districts are looking to engage, right, they're looking to address some of these outcomes, right? It's really us aligning those supports all together, right? And
So
so
what
it's going to be huge.
So what the state is doing is they brought this like technical committee together to develop theories of change for each goal and the drivers of those outcomes, and then trying to figure out how the health plans fit into some of those drivers of those outcomes. And so that's part of what Sam Marine and I are here to do. I'm sure there's an IEHP representative somewhere. We're here to kind of help the health plans show up to affect those drivers so that we can improve those outcomes.
So I think what we have to do, Gretchen Samarine and Amrita from IHP, she's not here today, but she's been talking, kind of been talking about this as well. Us getting an opportunity to meet outside of this meeting so that we can understand it better, so that we can begin to lead that. So
I'd be happy to put together a presentation for you.
Absolutely. Let's talk after this meeting about how we can set up an appointment to really have a bigger picture, bigger conversation with Farah, myself, and Marissa, and a couple of us to really better understand it, so we can see how we can support the work and really align our efforts.
Thank you, and I really apologize for derailing.
No. It's the context and the conversation that we need. So again, because we don't want it just to be siloed work around behavior. Like it's not just school and grades and all those. That's not what we want public health. We want population health, right? Totally at the end of the day, right? And education is one of the aspects that supports population health. It is not the outcome. It's one of the strategies that we should be utilizing. So that's our belief. Jillian?
Hi, and then I'm actually going backwards, but only if kind of our population folks are done. Don't want to interrupt. Okay, perfect. I see a thumbs up from Gretchen. You mentioned the technical assistance about billing. So going back to that topic, I would love to kind of gauge our internal partners. And this is kind of, again, the difference between Gretchen and I. I'm responsive to the, the kind of general asks and things like that. But I would love a list of what types of services you are charging for right now. Unfortunately, I don't have that level of detail, but if you give me that level of detail, I'll be able to kind of trace the web back internally and help bring a good person. And we could email offline and try to workshop where best that could fit in.
Yeah. No, again, when we think of our community of practice and we're thinking of our office hours, these kind of practical and technical support measures would be great for us. So no, Gretchen, I mean, Jillian, let's talk, and we can get some of that data from our educational partners around the services that they're providing, so we can get a better pinpoint of what that technical support could look like and what we could be bringing. So no, thank you for that. Okay. Marissa, Karen,
Yeah,
y'all.
if I can just address two things. One, just the conversation around, I think what Jillian just mentioned, and when we're looking at the various individuals that can build towards the fee schedule, and maybe our smaller districts that don't have the level of individuals that have done this kind of billing before and having to write the notes for that billing and the information that will be necessary for that. I think in our office hours and community of practice time, we could really leverage individuals that could help our LEAs to kind of create capacity around writing those notes so that they will be approved for billing when they do submit. So I think that would be helpful. And this may come up a little later to Gretchen's point. A lot of our school districts are doing a lot of work in regards to implementation of wellness centers on their campuses, and really how they can leverage maybe some of the work that you're doing in the wellness center space that can help with those indicators, that graduation rate, that chronic absenteeism that we're referring to, having students that are showing signs of depression, or they're dealing with grief, or different aspects that are affecting their day-to-day ability to be able to really participate in school, engage in school, and leverage what's happening at the school sites. And so I think that your work would really help to impact what's happening at our wellness centers and really help the members that are school people that are in those wellness center spaces create really good spaces for our students that can meet their tier 1 and tier 2 supports before having to move to that tier 3 support. So I just wanted to kind of mention that.
Yeah, no,
Thank you,
that's
James.
great. No, that's great. That's great. So we'll go to the next slide, and I think that's where we start getting into the wellness center. Oh, so our electronic health record. Again, we chose Healthy Campus as our vendor, and again, one of the outcomes or things that one of our priorities for the capacity grant was to provide our participating districts who needed it, needed a health record to kind of get them started. So we have 26 of the 56 districts or LEAs who are going to be working or going to be working alongside us with Healthy Campus to implement that as their electronic health record, right? So Healthy Campus is providing on-site training for administrators, directors and supervisors, and then practitioner training. So again, we were kind of talking about Liz, right? Making sure that we engage not just the administrative aspect of the work, but also those practitioners who would actually be the ones inputting and utilizing the health camp, the EHR, that they're a part of that conversation. So again, some of those districts, Liz, and those clinicians that you're working with, checking in with them to see if they're getting an opportunity to be a part of those conversations, or if they have feedback of how those trainings could be better, right? As our vendor, we have a really good relationship with Healthy Campus, and so they're always asking us for feedback. And so if some of our clinicians are saying, "Oh, this might be better if we could do this," we certainly want to provide Healthy Campus with some of that input as well. Okay, so just want to make sure we lift that up in the space. we go to the next slide. And so this kind of goes, Gretchen and Samarin, what you guys were talking about, right? So we have a vision of really aligning right now. How that's going to happen is really what we're in the development stage of, right? We do have a vision of just aligning and really developing this coordinated system of care, and we've really put this work or put the make the foundation of this work. Go to the next slide around our county's community vital signs, right? And so let's go past this because we kind of, but I want to go to our community vital signs, which is this work is led out of our Department of Public Health, right? The county's public health work, where we are getting the public health surveys our county residents to find out the health priorities of the county, and then those health priorities become focus areas for our county, and a strategic plan is developed to actually implement and support what our residents says are the important safe or health outcomes, right? And so this go around, these are the 3 priority areas for our county. And so we've been really working alongside with our public health partners to really support this work from a public health standpoint, and then we support it in the educational space, right? And so, but the big picture is that we have a healthy San Bernardino County, right? And so we are supporting, we are champion, San Bernardino County Superintendent is leading and facilitating the work around the behavioral health strategy, right? So it is very important that we engage with our managed care plans and you guys around the work you guys are talking about, so we can make sure we're aligning it to this, right? And so the community vital signs, if you haven't heard of that, tattoo it into your minds, because this is, we believe this is foundational, because this is the work of the county, not county schools, but the county large, right? So we go to the next slide. And when we're thinking of the behavioral health strategy, and again, I know Melina, Kaiser, IHP, you guys do work across all different areas, but a major portion of this work is the portion around behavioral health is in the strategy around school-based health centers and wellness centers, right? So we see this as a mechanism to really strengthen our prevention, our intervention as well, right? And so when we're talking about population health, this is one of the strategies that we feel that schools can be leveraged to actually support some of that work happening, right? And so we've been facilitating the work with community partners in developing in a way that we want to meet this goal. You kind of see the goal there, just to increase the number and utilization of school-based health centers and student wellness centers in our county, right? And so that's been the work that we've been facilitating. We go to the next slide. And I want to, what we first started was really defining those 2 strategies, right? So many times people say, "Oh, I have a wellness center," and it might be a calming corner in their classroom, right? So we want to make sure that we have a county definition for these 2 strategies, right? And when we look at these 2 strategies, really the way that I make it easy is when we're thinking of our wellness centers, we're really thinking about prevention, right? We're thinking about education. We're thinking about connecting, right? And then when we think of our school-based health centers, we're thinking of services, we're thinking of interventions, right? So again, really coming up with a county definition. Now, this isn't the definition, the national definition, but when we're talking about these 2 strategies in our county, if you're hearing it from San Bernardino County Superintendent of Schools, you're hearing it from Public Health, if you're hearing it from even our partners who have helped us with this School-Based Health Alliance, at least for our county, that we've defined these 2 strategies in a way that we can all be talking about the same thing. Okay, so take a moment to kind of look at that, right? Look at those definitions. But again, just prevention, really education in the wellness centers, and clinical services happening in that school-based health center. So then when you think of Samarin and Gretchen, when you're thinking about that population health, work that you guys are describing, this is one of the ways that we see that that can be, so you can support it in this manner. So, Summer, you gonna say something?
Yes, I was going to ask actually. So these wellness centers, I just wanted to know what the uptake has been like, if anyone can share in any of the areas where one of these, I mean, this is a really nice one. So, you know, in a previous county that I worked in, there was quite a bit of usage in the beginning. It seemed to have died down, but then it goes up and down. So would love to hear about, you know, how students are interacting with that wellness center, if anybody has any.
Mara, Karen, Alex, anything? Marissa?
So from our experience, I think it just depends on the school. There's some schools that are well established, so they have a good system where they built it to where students aren't just going in just for fun or just to get out of class. So they've been able to build that system so it can be used effectively. And then you got other charters or LEAs that are they're kind of learning best practices from other LEAs. So currently we do a wellness center tour where we allow some LEAs to open up their space and showcase the structure and the systems that they have. And we allow other LEAs from the outside to come and learn from these LEAs that have well-established centers. So if anybody else has anything else to say, you can share.
Yeah. So, Samarine, I think one of the things that we're finding, and this goes back just to alignment of helping our districts and our LEAs, people who are utilizing these things, to utilize them in a practical way, right? Like helping people to truly implement this in a way of fidelity, right? So I think what we're finding is there's too many variances of how these two are being built. Part of the work we're doing with public health is to start to get some continuity around how wellness centers and school-based health centers could be called, how they're defined, but two, also how they're implemented, right? And that's part of the work that we want to help lead. We go to the next slide because I want you to see, Samarine, how many of the wellness centers and school-based health centers are actually happening in our county, right? So this is a picture or a slide showing you just of the current school-based health centers in our county, right? And so again, when you see, I don't know, maybe that's like 9 current school-based health centers, and you might have 9 different approaches in that. And that's what we want to kind of help support. Again, not take away context and local control of how they implement it, but actually just the fidelity of these strategies, right? Go to the next slide because then you can kind of see that we also have some coming up. I think somebody said something about Silver Valley. Oh, Liz was saying Silver Valley was in the call, but Silver Valley, one of our high desert districts, being led by one of our good friends and a champion around this work, Cami. They have one that they're building right now and should be opening pretty soon. But again, we have districts who are really leaning into this opportunity of building these school-based health centers, right? And utilizing them as a means to actually support population health, right? Like the health of their community, right? Next slide can show you the number of wellness centers in our counties, right? Current active wellness centers. And so again, a lot of energy around these two strategies, Samarine. So like you said, like you were in other counties you were supporting, it's a high energetic strategy that people are really digging into. The problem is, are we able to implement it with fidelity? Are we able to do it and get the impact that we're trying to get, right? I think that's really what we want to be focusing on. And again, this space, thank you, Gabrielle, getting the people in this room to actually help with building the fidelity and the muscles around doing it impactful is what we want to do. Because again, this is not the work of school folks, right? Like this isn't what schools have always traditionally done, but they are being asked to do that now, right? They're seeing that there's a need and they're trying to fit that need, right? Any thoughts, questions around what you've seen around just school-based health centers, the wellness centers, community vital signs? Any thoughts or connections, especially for our population health folks? Certainly want to make sure we connecting.
The behavioral health services that are provided, are those through the health plan, through the county, through the school itself?
Through the school, Gretchen. So again, when we're talking about a lot of the conversation here, that's what we want to make sure we're getting much more sound at implementing is where our schools are understanding that they do what do y'all call it? Um, oh my gosh, what's the word, Jill? The non-specialty, right? The non-specialty services, right?
Yes.
And then they know to pass those specialty services over to our behavioral health to our contracts, our behavioral health contracts, right? Right now, many of our districts don't know how to differentiate that, Gretchen, right? So they are trying to utilize our behavioral health contractors as the all clinical services, right? And so part of the role of our team has really been to help them see where, again, you guys do that preventative piece, and you can be doing that in your wellness centers with your certified wellness coaches, right? You could be doing that with some of your interns. Then you might have some associates who are doing some of the therapy for your tier two, for some of those early interventions. But you have a student who's beyond that scope of work. Now this is when you start to tap into your contractor, right? Which again, we don't want to overwhelm that system because you don't have enough people to provide this. So you got to be able to identify the right students for those services. And that's where our districts haven't got so savvy at yet, Gretchen.
Okay, I'm curious if there's like an opportunity for like telehealth services or something like that for counseling.
Yeah. Well, there's certainly a need, Gretchen. So if
Yeah.
opportunity also equals need, then absolutely, there's a need, especially when we're thinking about some of our more resource desert areas, right? Some of our districts who don't have people who are out there with, it might be one counselor in the whole little town. You know what I mean? So provide some of those services, and that's the thing that we want to make sure we're bringing partners in who can bring those kind of services to our communities, to our school communities, right? And so certainly again, just want to make sure that we're connecting you. If you're seeing any dots, or we want to make sure when we meet, we kind of already have a foundation that we know we can work from. We go to the next slide. And so the school-based health centers and wellness centers, again, we see them as a way to really centralize that wellness, that student wellness, and build the ecosystem in the schools. So a lot of the work, Gretchen Samari, I don't know if you guys have heard a lot of the conversation around community schools, right? I won't get too deep into that, but that's we can talk about that when we get to meet, because that's a major opportunity that the state has set for us to also leverage as a means to actually strengthen community, ultimately population health, right? So I love that word now, right? Population health, but utilizing these strategies or these forums as a means to do the work and develop the ecosystem that we want to have in San Bernardino County with the players and the partners that we have in our county, right? And I think that's the piece that we want to really define, in that we want a system of care, but we want it to mirror our community, right? And so that's the work that we've been doing. So really bringing together the services, the partners, and the data. I didn't even look at that, right? But under one roof, right? So whoever did the slides is in my brain, right? But that's what we are really trying to accomplish, right? And San Bernardino County Superintendent of Schools is really just the bridge or the intercessor. I don't know. My sister Sue always got different words for it, but we always the convener. That's the word she always uses. We're the conveners, right? And we want to bring the partners in. We don't do direct services. We don't provide. We don't have students in our office. So we don't provide any kind of service from our office. But we do want to convene the partners to get to our LEAs, right? That's the role that we play. and then really help to align different players all together. So you talk about population health, our job is to, okay, where does this fit in the bigger puzzle? Right? That's what we want to do. And then we can bring that to Rialto. We can bring that to OMSD, and then they put it into their context. Right? So, Cecilia.
I know someone had mentioned something about telehealth. We were at a adult ed resource fair in our district. We were sitting next to a company that just started and is trying to kind of provide that service. I guess they're already working with some of the school districts surrounding us. Can we make those referrals to you so that we can kind of have that resource as well? I just got their card and everything, but they do telehealth for mental health services. And I know that that was something new that we hadn't heard about, but I got their information. Is that something I can share out with the team?
Absolutely.
Okay, so I have all her information. She reached out to me via email, and I got some of the handouts. They were sitting at a table next to us because we do a lot of the fairs, and we provide resources to our community as well as like behavioral health. We have the physical health piece because we're health services.
Right.
But I know Gretchen was talking about the whole population health. This is what we do in our service area. We provide nursing services. We provide emergency care. We do CPR and first aid. So a lot of the stuff we do, and we're in cohort 1, even though we haven't started claiming, but James and Marwa know our situation right now. So we're trying to do other things. We do have that wellness center tour that Alex was talking about. That'll be at Carter High School. I will be part of that as well. And I'm going to be speaking on the multi-payer fee schedule and where we're at this point with the capacity grant. But our school district also just got community schools. So I'm looking into expanding our school-based health center as well, because we used to have one. And then we contracted with SAC, but now we have that space back. So I've been talking with our family and community engagement, trying to tie in all those bits and pieces that we're discussing. So it's like, it's here. It's just not, we need to get everybody to come together. And that's what I'm trying to, I'm trying to get that across. So
so that's the work, right? And no, you're absolutely right. That's the work, is really bringing everybody together. I think we all know what to do in our own silos and in our different areas. Is really bringing everyone under what they say, under one roof, right? And that bullet, right? So, and then we do that at a county level, and then we have to help our individual communities and school districts do it in their locus of control, right? And so we want San Bernardino County Superintendent of Schools is really looking to be that. How do we do that as a big county, right? And develop the tools and the strategies for that, and then help our districts to do that within their own branches or departments and things that they do there. So, Cecilia, you're seeing it. You've been in a lot of conversations. You've been around us for a long time, so you starting to sound like us, like you done drunk the Kool-Aid, right? But no, that's the work though, Cecilia. So appreciate you lifting that up. We'll go to the next slide. I know we got a couple minutes left. I was supposed to let y'all out an hour, and then I get into it and I start talking. But just again, the whole work, and I appreciate Melina, Kaiser, and IEPU is here, and our school districts being here. The work is really around partnerships, and I think that's what we want to continue to lift up and continue to beat that drum of just the partnerships that are going to. We don't have enough resources in our schools. We have to leverage our partners to really to do this. So wherever you see yourself is really where we want to help fit you in, right? And so just a picture and a remembrance of the importance of partnerships as we have this conversation. And it's all relationships, y'all, right? All relationships. And so we want to make sure that we never forget that this is the truly the foundation of all the work. Go to the next slide. Kind of just said that, but there's a question, right? So which part of the ecosystem, prevention, intervention, data, sustainability, most aligns with your organization or, because as Gretchen said, the work that you do in your organization, right? That's a different thing, right? So just put something in the chat. You ain't got to open up your mic and do it. Y'all don't want to talk to me anyway, but put something in the chat just around just where you see how this conversation and the work that you can bring to this, how it aligns and where how it aligns with the part of your part in your organization, so we can capture that. Yeah. Good. Yeah. No, that's good. So like I said, we were just talking about just the data agreements too, Samarine. We were having a conversation that in the training we were at today, right? And so getting access to that, Jill, of course, sustainability. So yes, prevention intervention. Another part of the work that we're trying to do in San Bernardino County in our department is really bring some the nursing coordination as well, right? So that's something that we're working towards. So a lot of moving pieces and us trying to get things in place. So we go, I think we got maybe one more slide. So just this slide, we really like this slide just to kind of just show just how this ecosystem that we are envisioning, again, it's not has not flourished, or I don't know if that's the word, has not happened yet, but this is the vision that we want to have. So Gretchen, Samarine, as you guys are new to the space, really this is where we really want ultimately to have, right? Just a sustainable ecosystem of care for students. And again, it says for students because of course we're school folks, but it's actually for the county, for people, right? Healthy families, healthy kids, healthy schools, right? So it all is a domino, or we're all connected in a way that that if one is doing well, we all can do well, right? If one's not doing right, then it's a link somewhere. So it says students, but ultimately we know it's community, it's families, it's population, it's people, right? That we want to help build the systems. And again, that takes funding, it takes systems approach, right, to it. It takes infrastructure, it takes capacity building, a lot of planning, right? Student access to services, community access to services, and then expertise. And that's why we try to bring this space, we try to create in this space where we get the right partners and the lens and perspective that you guys have from your standpoint to bring that standpoint and that perspective and that expertise to the work that we're trying to all put together and puzzle together, right? Yeah. How come to that? So again, uh, Gretchen, 100%, right? San Bernardino County resident. Again, that's Farrah and I. And Farrah's the director. I do a lot. I'm probably the microphone, but Farrah's always the one kind of pushing it, right? But again, she's always talking about not just we support students, but again, healthy people, healthy communities is what we want to champion in this work. So again. Get some healthy adults, and then we can get the outcomes. Our graduation rates will be up. Our chronic absentee will be down. All those things. Getting healthy adults will get us healthy kids. That's our last slide. I just any thoughts, anything that comes to mind. Thank you for the moving the slide. Any thoughts? Um, Questions, ahas, anything for the greater good of the group? No. So next time we have a meeting, I don't know what our next meeting date, y'all, but y'all gotta talk more next time, right? I'm a set up where there's a lot more questions or something. So there's more conversation. No, and then what we're gonna do, Gretchen, please stay on. Gretchen and Samarine, you guys stay on so we can try to make sure we exchange emails and we can set up some time for you, Farah and Marissa and I, for us to all meet and really strategize and see where we're connected. Farah, you gonna say something?
I was just going to say thank you to everybody today for attending, and thank you, James and team, for doing a fantastic job in relaying our message. And James is such a great, like he said, microphone. So he's always, does such a great job along with the team and putting all of this together. So thank you. And just to reiterate that we are partners, and we're really excited to meet some of you today that are new. And we really are partners in our community health. And so I just wanted to extend my appreciation.
Yeah, no, thank you. Thank you for that. And again, Jillian, all you guys, Gabriella, our LEAs, thank you guys. Liz, thank you for coming. And certainly, again, Liz, just tapping in with you to really help with our clinicians and how we can support them and how they can support this work as well, right? So it's really getting everyone all moving in the same direction, doing what they do, but all moving in one direction. So absolutely just appreciate you guys' time. You guys got about 13 minutes of your time back. So I appreciate it all you all for your time. And we'll get the next date out to you all as well. Thank you.